Migraine Australia. Today on the line, I have Jordan Siebenhausen, a vestibular physiotherapist in the Gold Coast, ready to tell us all about vestibular migraine. Welcome, Jordan. Can you tell us what vestibular migraine is?
Yeah, thanks for having me on, Laura. So vestibular migraine, basically the way that I explain it to people is I commonly use the analogy that if you've had a computer in the past that's overheated, or you've opened up too many programs, and basically what happens is that computer overheats or it gets confused, and then it starts shutting down and blocking on you. And basically with vestibular migraine, when people have a build up of stresses, whether it's things going on at work or you've missed a meal or things like that can build up and cause that migraine. So it's a migraine. It's got a subtype too with vestibular systems. So basically you get these vertigo type symptoms sometimes with migraine. Some people that have vestibular migraine actually don't have headaches in there as well. I think that's really important too. So it's basically a migraine with vestibular vertigo, dizziness type symptoms.
Yeah, see, that's really interesting because I know when I got my diagnosis of vestibular migraine, that was something that had really stumped the neuros, that I was getting dizziness, but I didn't have any pain. How common is vestibular migraine? Was it just me that when I got my diagnosis that it was quite foreign? Do many people come to you and they've got no idea, or is that just something I misconstrue?
Yeah, it's definitely in the categories, it's definitely in that chronic dizziness type category, just because people have had it for such a long time and sort of had a lot of different diagnoses. Sometimes they get a Meniere's diagnosis or something else before you sort of say to them, look, I think this is a vestibular migraine. It's not a very commonly known condition at the moment either, and I think that's something that we need to change over time, because actually in America is that they're finding out that it's just about as common as asthma and diabetes. I think 1 in every 7 Americans has vestibular migraine. So it's very, very common, and unfortunately it's not very well known. I think in a lot of the medical world, definitely in my area, which is private practice and working with GPs, that it's not very common knowledge, unfortunately.
So how is vestibular migraine diagnosed? Like, I know when I saw someone like that over in WA, he sort of saw me in the first 5 minutes and he goes, no, you have vestibular migraine. So how can you tell?
Yeah, unfortunately, migraine can definitely mimic a lot of our vestibular conditions. So as a vestibular therapist, we treat, several types of conditions that can have vertigo as a symptom. And I think that's really clear for people to understand that if you walk into a doctor and you get told for, 5 or 10 years that you have vertigo is your symptom and you just have to kind of deal with it, I think that's really poor healthcare, in my opinion. So I think getting that out there, that vertigo is not a diagnosis, but basically with vestibular migraine it's described as a diagnosis of exclusion. So basically we go through screening and making sure that there's no other, conditions that we can help with, such as a BPPV or a vestibular neuritis or other ear infections or anything like that. And we rule out all of those diagnoses, and we can also go from a central point of view and make sure there's nothing going on from a brain point of view. Basically, once we get to ruling out all those other pathologies, and then vestibular migraine has its own diagnostic criteria that has certain steps and a certain history that we check those boxes. And normally I will let the neurologist or the GP make the diagnosis of a vestibular migraine, but I will probably plant the seed with patients for a start and hand them over to a neurologist and let them make the diagnoses from there, because they will obviously do an MRI of their brain if they think that that's required.
Yeah, that's really interesting, because that sort of resonates with me, because that was very much my journey. Now, I know when people reach out to me, are everyone's symptoms the same? Because sometimes the symptoms I might have, so I don't just get the typical dizziness, I have sort of the derealization and the disequilibrium. I sometimes get nauseous. Exhaustion was one big one for me in the very beginning until I learned to sort of get things under control. Are everyone's symptoms the same, or do they vary among person? If so, is there a reason for that, or is it just affects everyone differently?
Yeah, it's really interesting. So actually within the research that we've known that people have so much variation in their symptoms. I think there was one study that had a very small group of people and there were 42 different triggers to their migraines. So there's a huge amount of variation in people's triggers, but also their symptoms. So some people talk about they get this room spinning type vertigo. Some people get disequilibrium or feeling like they're off balance is a really common one. Some people with vestibular migraine actually don't get headaches. And I think that's really clear, like I said before, is that vestibular migraine, the migraine part, people thinking that, oh, if I don't have a headache, I can't have vestibular migraine. That's not true. So we know that people can have a vestibular migraine without headaches. Definitely a huge variation in symptoms between person to person though. And I think that's very individual, and people describe that, their symptoms are their symptoms. I think it presents in many different ways, absolutely.
So now we know that there's no real cure as such for migraine disorders as a whole.
Yeah.
But how do people cope with their symptoms? I know for myself, I followed a very holistic journey when I started before I saw a neurologist. And from there, I've jumped on medications. But a lot of other things had to change for me. So what do you show as like the treatment plan for someone that would come to you and say, or that someone presents with dizziness and you recognize it is vestibular migraine?
Yeah, it's really dependent upon where I sort of come into their story, if that makes sense. So if somebody comes to me as a vestibular physio because you don't need a referral to come and see me, you can just come and see me within a private practice and not have to have a GP referral or anything like that. Generally, if I'm getting somebody that's off the street and says to me, look, I've had these vertigo type symptoms for 5 or 6 years now, nobody's been able to help me, I will try and help them in terms of their management of their stress and their triggers and things like that, and talk about exercise and movement and little lifestyle factors. I might sometimes talk about supplements with them as well, but a lot of the time I'm referring and getting help from the neurologist from a medication point of view. I'm getting help from the GP for supplements or some other things that can help as well, and also sometimes even getting a dietitian on board as well. I think it's really important to get a whole team behind you as a patient. And, you've got your vestibular physio is going to help you with, people with a vestibular migraine have balance issues, and you're more likely to develop a BPPV from a vestibular migraine as well. And that's where your vestibular physio can come in and treat that and help you, increase your balance and increase how much you're moving and exercising and all those sorts of things, and helping with your triggers. And then the neurologist comes in from obviously the medication point of view, like I said before, and the dietitian can help with some food triggers as well. So I think tackling vestibular migraine from a multidisciplinary team type scenario, rather than just going, all right, this is my patient, you're only going to see me with vestibular migraine, I think that's also can be detrimental to the patient too. So definitely referring out to different practitioners. But from my point of view, I'm looking at triggers for your migraines, keeping a diary, looking at what's triggering it. Definitely for me, I think with people who have vestibular migraine, avoid situations that provoke the migraine. I try to gradually over time build that up and build their tolerance up to getting out and about, and not have to avoid things so much. So it's more of a graded exposure to those environments or something that triggers their dizziness, not doing that going from 0 to 100. I think it's really important to gradually expose them to little stimulus at a time, whether it's, I often talk about green time with people. So going out for a walk for, even if it's 5 minutes, in a natural, peaceful environment that they feel comfortable in. And if that's what they can handle, that's what they can handle. You start from 5 minutes and you just build that up over time. So you get that under your belt and you get that in the bank, and then you just build that on over time.
I wish I was over in the Gold Coast, because I think it would have been a great therapist for me. But that's some of the stuff that I have pieced together through information that has been available for me, and a lot of connecting the dots. And even like for those watching, I used to move my head a lot, even when talking. And was something my physio had picked up straight away, was he's like, you need to stop bobbling your head around, because it's aggravating everything, in the height of when I was at the worst. I think it's really great that you combine everything together, because my journey, and I know actually a few others, was very disjointed. We've had to connect the dots together. So I think that's something that is really interesting. Now, the word vestibular rehabilitation therapy was something to me which I had never heard before. It's such a foreign word, VRT. Can you just explain that for people? I know I have people that reach out to me and they ask what medication I'm on. They ask that medical side of things, but they don't realize there's this whole other side that goes with it, like you mentioned, like the foods that you eat, the exercises that you do, and even getting outside. You know, I know for me, when I first got diagnosed, like walking to the end of my driveway was a big deal, but I do it because it would help me gradually retain the confidence to know that I'm not going to pass out. I'm not necessarily, nothing terrible is going to happen, but I do, it's building that strength back up again, I think.
Yeah, absolutely. And building that tolerance, and that sort of, we use words like resilience and tolerance and all those sorts of things, and being able to, you know, slowly build yourself up over time. If you can walk to your driveway and that's what you can handle, let's work on that. Let's work on things that you can control and building that up and build that resilience up. First part of your question in terms of what is vestibular rehab. So basically vestibular rehab was, you know, created it's very, very effective for treating vestibular hypofunctions in particular. So somebody who has an inner ear infection, such as a vestibular neuritis or a vestibular labyrinthitis. Basically what we're doing is different parts to vestibular rehabilitation. So encompasses basically principles of neuroplasticity. So basically we're creating and reteaching the brain how to cope with dizziness. Okay. So typically after a vestibular neuritis, you will have a hypo function on one side, meaning that the vestibular system on, say, your left side has been affected, is not working as well as the other side. So the brain has basically got to try and figure out the input from both sides and try and level that out. Okay. Young people typically will respond to this pretty well. Okay. Because obviously age is on their side, but with vestibular rehab, we can sort of even out the sides, so that when you turn your head to the left, or you know, typically, you know, getting out throughout the day and you're looking at the shops and you're scanning and you're moving, even when you're driving, you don't get that dizziness when you turn your head quickly because there's too much visual input coming in. So that we've used that vestibular rehab principles from treating vestibular neuritis and labyrinthitis and other conditions such as Meniere's and even BPPV as well. And you tried to use that in vestibular migraine. It hasn't got a huge quality evidence for gait stability exercises. So that's when we're doing a lot of head movement type activity. Sometimes it can actually flare up people with vestibular migraine. Like you said before, that turning your head from left and right would sort of exacerbate it a little bit. So we do that very gently with people with vestibular migraines. We do gently. We do probably more balance assessments and looking at how people with vestibular migraine, how they do balance and trying to retrain from that point of view and doing things that are healthy for your vestibular system, like ball sports, for an example, is very, very good for your vestibular system and that hand-eye coordination as well. So I'll often encourage people to do things that are healthy for your vestibular. I talk about that it's healthy for your vestibular system, or if it's healthy for your brain. You know, getting out and playing a ball sport and getting that hand-eye coordination and getting that head movement with there as well. And you get some eye tracking in there as well with that ball. So that sort of encompasses how we use vestibular rehab therapy for vestibular migraine. So it's a little bit different to a traditional vestibular neuritis or something like that. But we use the same principles as that when we're using neuroplasticity to try and help the brain to cope or manage with those migraines.
Yeah, see, I could just listen to this stuff all day because I think it's so fascinating. And I think the big thing about vestibular migraine, and I know a lot of people I speak to as well, because it's such a foreign feeling and it is quite natural to feel so scared, you get scared to go out and do the things you would usually do. So therefore you're always almost moving backwards because you're not retraining your brain like you explained. Now, a big one, a question I got, and I have traveled since, but is people get scared to go out and try things like travel because they think it's going to come out like, you know, their attack is going to be bigger than normal. Now, I sort of explain it that, you know, my attacks now, I still get them, but they're not as severe as what they were before. And my way of controlling them, I know that it's a vestibular attack. Like I know that it's not having, nothing else is happening other than my vestibular system, which is off kilter. So do you have any tricks for people that, you know, are there precautions that people should take when they are, you know, I know we're in COVID-19 at the moment, but if they are traveling or, you know, you sort of spoke about it before, but making sure you're looking after yourself, like sleep and water. I know that for me, like jumping on a midnight flight, I can't do because it's not just an exhaustion point of view. I don't get dizziness from the flying, I probably get the dizziness from the exhaustion of staying up the whole night. You know what I mean?
Yeah, absolutely. I think the biggest thing, like you said there before, is that you get less anxious with traveling now because you know that it's a vestibular attack related to your vestibular migraine. So I think that's really powerful with vestibular migraine, actually, people knowing a diagnosis and knowing how to self-manage. I think giving patients the power to understand what their condition is and how they can manage it and what their triggers are and all of those sorts of things. I think that's really important, to put the power back onto you to be able to control your stresses and your triggers and all of those sorts of things. And knowing that, you know, that your dizziness and your vertigo isn't something very, you know, vestibular migraine is quite serious, but obviously not life-threatening. I think that's one thing that sort of adds into that. It's that fear avoidance of, if I go outside, I'll get these attacks and I don't know what the attacks are. I think the fear of not knowing what the attacks are and what's causing them, I think that's a huge part of it. Just sort of the fear of going out and then not knowing what this dizziness is. I think that's a huge factor.
Oh, look, and that's how I ended up in emergency so many times when I was trying to find my diagnosis, because I had no idea what was going on. I thought there must be something seriously wrong.
Yeah.
But I think that all comes down to the awareness, knowing that migraine disorders are very real. It's not just a headache. It's not just vertigo. You can't just pop a pill and it's all going to disappear. And I think that's what's really important. I think what, to me, and why I'm so passionate about advocating, is because there must be so many people that are undiagnosed. And I don't know if that's something that you see someone who has been going through it a lot longer before actually presenting to you.
Yeah, absolutely. It's very, very common. You know, and I'm also guilty of sometimes not knowing whether, you know, if I'm thinking that it's one of two diagnoses, because we know that vestibular migraine can mimic other serious pathologies as well. So, you know, at the start, I won't be too sure as to whether it's a vestibular migraine or another pathology, and then I'll refer to the neurologist and go, look, what do you think here? So, you know, even when I'm treating somebody, there might be a couple of weeks or, you know, a month or so before we get a diagnosis, but people go on for years before they know exactly what's causing these attacks. And they've just been told, and this is why I have that pet hate of vertigo, you know, a diagnosis, is that people just go, I have vertigo. And then each attack that they get, they get very anxious as a result, and then that makes it worse. This constant sort of fear avoidance and that consistent cycle of
I used to have panic attacks. I used to drive and my vestibular migraines would come on and I'd panic. And of course, when you panic, it heightens every single symptom and it scares you even more. Whereas now if I feel it coming on, I know what it is. I know that I need to pull over, or I know that something has triggered it. So I think that constant education and the work that you're doing is so fabulous. If people want to get in contact with you, or if they're interested in making an appointment to sort of see you further, how can they go about doing that?
Yeah, absolutely. So obviously people can send me an email, or you can contact me I've just jumped on the Instagram bandwagon as of recently. So you can definitely send me a message on Instagram at Vestibular Physio. But yeah, you can shoot me a message through Instagram. I sort of jumped on the Instagram bandwagon as a vestibular physio. There's a lot of musculoskeletal physios on Instagram, but there's not many vestibular vertigo physios out there. So I think that's sort of why I made the leap into the area. And I'm relatively new to the vestibular world as well. I've been a vestibular physio for just over a year now, and I'm really loving what I'm doing at the moment. A lot of other vestibular physios in your area, and it's a matter of obviously finding those vestibular physios, because there's a lot of very, very good ones around the world, that's for sure.
And I think the information that you are putting up, for those that haven't seen Jordan's channel and Instagram, the information that you are putting up is getting attention from all around the world. Because I see people that are on there and they're so thankful for the resources that you put up, because it's almost like clarification that, that's normal. You know, and I think that's the one that we touched on so much before, was that's what vestibular is. And I think in collaboration with the vestibular.org provide and what you provide, I think is so, having a physio like yourself in Australia that Australians can connect with, I think is huge. So thank you so much for all that you're doing. And we will see more of Jordan throughout Migraine Awareness Month as he jumps onto our physiotherapist panel. So make sure you stay tuned for that. And thank you so much for jumping in and watching, everyone.
No worries at all. Thanks very much for having me.